So what I'm going to talk about today is some of the HR portions of this leave situation. We've got the FMLA leave that's been expanded to small businesses, and we have the paid sick leave that's being given for employees who need it. So we're going to run through just a few highlights of those. There's definitely additional information that's coming out every day. I feel like every few hours I receive an email with an update, including this morning. So we're going to go through all this information, but just please keep in mind that these regulations and interpretations are changing daily. The IRS, I think, is fighting with the DOL regarding documentation at the present time. So it's something that's constantly changing. So just keep that in mind. Obviously, I'm not a lawyer, so it's not legal advice, but we're just going to run through some of the highlights of the information that's being sent out to small businesses across the country. So, like I said, first we're going to talk about the FMLA expansion and the paid sick leave, and then we're also going to talk about some of the other workplace impacts that this can have, whether it's OSHA, workers' comp, some of those other portions as well. So, as far as sick leave is concerned, or as far as sick employees are concerned, I wanted to run through some of the new updates regarding what you can and can't ask employees. For a long period of time under ADA and FMLA, you couldn't ask an employee what they had, what their symptoms were. But because of this global situation, we're now allowed to ask them if they have any symptoms even before they come into the workplace. Are you experiencing any symptoms regarding this COVID-19 virus? Are any of your family members or anybody who lives with you experiencing these symptoms? You're dealing with a lot of employees that are exposed in different ways, whether it's in the workplace or in the grocery store. So any indication that they're experiencing these symptoms, you're going to want to send them home. Obviously, you'll make your best judgment based on the information that you have, keeping in mind that taking an employee's fever doesn't always indicate that they have it or they don't have it. So just, keep that in mind. But if you are having employees or their family members or whomever they live with, experiencing the symptoms, in an effort to stop or at least reduce the spread of this virus, employers are allowed to send employees home. One of the biggest questions that I've had from small businesses, even across the country, not just in the Missouri area, is do I need to tell other employees in the workplace that there's been an exposure? It is important to let them know there's been an exposure, but you're not going to name the name. If you're a small 4-person office and one person is home, somebody might put 2 and 2 together. But we want to make sure that we're notifying people in the workplace. There's a sample I can send out, a sample notification letter that you can send out that has all the important details, but none of the details that kind of cross that line. And let employees know that way if they start to experience symptoms themselves, they know that there's a possible exposure. Obviously, as far as employees are concerned, if they're experiencing these, I've had a lot of questions over the last few weeks about employees returning to work. I do want to let employers know that nowadays they're relaxing the doctor's note requirement. They're giving a lot of guidance on emails from doctors or emails from telehealth visits. Telehealth is now seeing a big boom these days. Generally speaking, if an employee has symptoms and they go home, they have a fever, the general guidance right now, as of just a few days ago, is that if employees have had the fever, had respiratory problems, they've had some of the other symptoms, if they've gone 72 hours without a fever, without taking fever-reducing medications, then they're probably in a good place to come back to work. Another example is if it's been at least 7 days since their first symptoms appeared. So I think right now we're working with 14 hours for the symptoms to show up, that incubation period, and then another 14 days for that incubation period, and then another 7 days since that first symptom appeared. So you can have employees out of the workplace for a while. We'll talk about that paid sick leave option for them. Another question that I've had a lot of in regard to sick employees, if an employee is not sick, but they just don't want to come to work, they're nervous, they're scared, this is definitely unprecedented. That word's being thrown around left and right, but if they're not comfortable coming into the workplace, they need to have a legitimate concern for a threat of exposure, whether there's an underlying health issue, if there's a family member that they know of, somebody else who's had an exposure and that person is still coming into work. Those are some examples of legitimate reasons or concerns for the threat of exposure. But if you don't have those legitimate reasons in place, or you don't have an accommodation need, then employees really do need to come into work. I know that sounds harsh. We're all trying to keep our businesses going during this time. So just kind of work with the information that we have and make that best judgment based on that information. So as far as FMLA is concerned, I provided you an overview of what the current FMLA program has and where it's been expanded during this unprecedented time. Normally, eligible leave is for a self medical situation or for an immediate family member medical information or medical situation. Immediate family member is really defined very closely under the current FMLA regulations, but as of now, with this new expansion under FMLA, anybody who can't work or can't telework due to a minor where the school has been closed, they're now part of this FMLA program. If their daycare has been closed due to the COVID-19, now employees can take FMLA time as far as taking, up to the 12 weeks, which is what the normal standard time off is. The other thing that's changed from current FMLA to the new expanded version of FMLA is that employer size, under the normal program, it's at least 50 employees, but now the new expansion is under 500 employees. So larger companies, across the country are still required to provide FMLA, but now smaller companies that are more in the 25 to 30 or even 4-person range are now required to provide this FMLA time off. It's specifically for this COVID-19 situation. Under the current or standard FMLA, the length of service that an employee has to work for the company in order to qualify was 12 months of service. Now the new expansion provides for coverage for employees who have been on the payroll for at least 30 calendar days. There are some exclusions, so keep that in mind. If there's any questions in regards to what your business specifically falls under, if it's close to the health arena, definitely reach out and ask those questions. But for most employers, it is that 30 calendar days. As far as paid leave is concerned, that has never been a portion of or a part of FMLA. Employees often get confused by that, but that's never been a portion of FMLA in the past under the standard FMLA. But now under the new expansion, specifically for COVID situations, the first 10 days is unpaid, and we're going to talk a little bit more about that in a few minutes. But then after that first 10 days or 2 weeks, the employer must pay at least 2/3 of the employee's regular rate of pay, keeping in mind any state or city minimums. But that employer must pay the employee after the first 10 days of FMLA. It is capped at $200 a day, which is $10,000 in total for the full 12 or the full 10-week period. As far as the first 10 days are concerned, this was a little bit murky in the beginning, but since within the last week or so, there's been some updated guidance from the Department of Labor that employers will probably be paying employees for the first 10 days under the emergency paid sick leave program. And for those employers that have their own employer paid leave programs that were in place before all of this change occurred, the requirement is if an employee is going to be paid for that 10 days, that they must use that emergency paid sick leave program first before they have the option of using any sick or vacation or other employer paid leave programs. So theoretically, your employees are going to be paid for the full time. They're going to be paid 100% of their wages for those first 10 days under the emergency paid sick leave program, and then they'll be paid 2/3 of their regular rate up to the cap for both of those programs for the remaining 10 weeks under FMLA if they need a full 10 weeks. One of the other differences in regards to the current or standard FMLA program is the reinstatement requirement. Generally, if you're under FMLA under the standard program, you must be reinstated to the same or similar job. There are some exceptions under the current FMLA program, but under the new expansion, it is not required for employers that are under 25 employees if the position has been eliminated. So as far as the paid sick leave program is concerned, as I mentioned, this is typically going to happen during the first 2 weeks of somebody taking time off from work. This paid sick leave program is in relation to illnesses, whether it's yourself or a family member, somebody that you take care of. But it's also, as I mentioned before, they're expanding this to children who are minors under 18 who can't go to school and don't have daycare options. There's also some other unique situations that may fall under this as well. If there's any questions, definitely reach out. But as far as the employers are concerned, all employers, same as the new expanded FMLA program, all employers under 500 employees and public agencies with at least one employee are required to provide this paid sick leave program, or they can provide it. The length of service is not defined. There's no length of service required. You can hire somebody today and tomorrow they start showing symptoms and they have to be out. The paid sick leave program would apply. As I mentioned before in the FMLA section, the first 2 weeks or the 80 hours for a full-time employee is what is covered under this emergency paid sick leave program. If you have part-time employees in your group, they're looking at an average of 2 weeks of hours. So if an employee works 10 hours 1 week and they work 5 hours the next week, then you're going to go with the 15 hours for that 2 week period. So 7.5 hours for 1 week and 7.5 hours for the second week. As far as qualifying leaves under the emergency paid sick leave program, there's a list here that I've shown of the 6 different types of leave. As we mentioned, anybody who is experiencing the symptoms or is seeking a medical diagnosis, if they're advised to self-quarantine due to there are other medical situations that may put them at a higher risk. If they're subject to a quarantine or isolation order, that's kind of the first group of qualifying leaves under the emergency paid sick leave program. And then ones that are not necessarily related to health would be anybody who's caring for an individual who meets the first 3 criteria. Anybody who is caring for a son or daughter, like I said, a minor under 18, if the school and daycare or daycare is closed. There's been a lot of questions over the last few weeks. If the school is closed but the daycare is still open, then that doesn't qualify. It has to be closure for both options, and there's no other options available for that employee to have care for their minor child or children. And then also there are some other undefined, similarly substantial conditions defined by the government. Again, those are going to be kind of unique situations, and those will fall under the non-medical portion. So as far as paid leave is concerned, if an employee meets one of the first 3 qualifying leave reasons, they are paid either at their regular rate of pay or the minimum wage, whichever is greater, and they are getting up to $511 a day, or the equivalent of $5,110 for that 2 week period. If the employee needs to take time off for the other 3, number 4, 5, or 6, so caring for an individual who is subject to the items 1 or 2 above, or if they are taking care of minor children due to closures or another similar condition, they are going to receive 2/3 of their regular rate of pay keeping in mind they have to at least receive the minimum wage, so whichever is greater. And so that is actually capped at $200 a day, or $2,000 for the 10-day period or the 2-week period. As I mentioned before, under the FMLA portion, employers cannot require their employees to use any of the regular employer paid leave programs before they use the Paid Leave Sick Act. So you must use the Paid Sick Leave Act before you can have the employee choose to use paid sick leave if you already had that in place before April 1st. If you have paid time off, vacation, or if you lump sum sick and vacation into just general paid time off for use as the employee needs to. So those must be used or can be used after the emergency paid sick leave.
Laura, we do have one question here. Are employers required to continue paying health insurance at the employer's cost while the employee is on the FMLA?
Yes, that's a standard under FMLA programs, and nothing has changed with that. When we go through the slide in a few minutes about tax credits, there is specifically a portion where the employer can receive tax credits in relation to maintaining the health coverage for the paid sick leave time and other programs.
Thank you.
Yeah. Any other questions that have come up? No? Okay. So I put together a few frequently asked questions based on various information that's coming in. It's still, like I said, it's still a little murky. The government's still trying to figure things out, interpret what they've put in place. Obviously, even as an employer, when you put a new policy in place, sometimes things will come up that you need to make some adjustments. That's normal. That's part of everything. So as far as the frequently asked questions that we've seen a lot of, employers are asking if employees can use intermittent leave. And the answer to that is yes, if the employer agrees to it. So if somebody, let's say for example, somebody has a daycare closure and they need to take care of their child 3 days a week, and then their spouse can take care of the child the other 2 days. They're splitting it so that, you know, the spouse will take care of them on whatever days. It can be a half day, it can be a few hours a day, it can be a partial week, whatever the case may be. Again, as long as the employer agrees to it, this can be used as intermittent leave.
All right, I'm going to stop you. I'm sorry, because I have a follow-up question to the last one.
Okay.
Before you keep going.
Here, yeah.
So what about the employee portion of that health insurance cost? Can an employer seek reimbursement from an employee when they come back to work, or does the employer have to pay the employee's portion?
So what typically happens under a standard FMLA program, and there's been no indication of any changes to this, and I understand small businesses, you haven't had to deal with this if you're under 50 employees, but what happens under a standard FMLA program is the employee is required to send in payments on schedule. So if you process those payments once a month, payroll once a month, or if your payroll is every other week or a weekly payroll, any portions that the employee is required to pay under normal circumstances, they are still required to pay that. And you can ask them to send in a check or make an online payment depending on what options are available. If employers want to relax those requirements and not make them pay until the employee is back to work, there might be some options for that. Again, it's an employer option. There are also, I'm not going to talk today about the small business side and the loans that are available, but there are a lot of loans and other grants and loans that are available to small businesses to help specifically with payroll costs. So if anybody's interested in getting more information on that, I have a lot of links, but I didn't go through all of that information for today's presentation. But if employers are looking to get some assistance, whether it's in grant form where you don't have to pay anything back, or in loan form where they're giving loans out for, gosh, 30 years, as long as a standard house mortgage. That will probably help some employers with taking these burdens until the employee gets back to work and can make those payments. So there are some options out there. But typically under a standard FMLA program, the employee is required to mail or send or make payment out of paid leave. So if you're doing paid leave, you can have that payment coming out of that paid leave payment through payroll. The employee can send in a check, make an online payment, depending on what the program is, the health insurance program.
Or does that include the PPP loan?
What is the PPP loan? What are we talking about?
I don't know. Let me see.
Okay.
The paycheck or the payroll protection program?
You know, I don't have any information on that, but I can certainly seek it out and let you know.
I'm getting a bunch of information from other places, so
Sure.
don't spend your time doing that at all. It sounds like you have enough.
It's all coming in from all different angles.
Yep, I'm getting all kinds of yeah. I just thought I'd check, so no worries.
Yeah, no, that is definitely not something that I put together for this, and I haven't been keeping a close eye on that side. Any other questions, Trish? No? Okay. One of the other portions, and this was an email that I received an update on even this morning at 8 a.m. Employers should get documentation from the various sources if an employee needs to take time off. So we're talking about school closures, so emails are being sent out, text messages. I think I got 4 or 5 different notifications from the school regarding closures. Daycare closures, and a simple email will work, newspaper articles, anything that an employee has to show that they are either under a quarantine order or the provider is advising quarantine. This morning, this definition has even expanded to employee affidavits. So the Department of Labor has put on their webpage, and I will include that in the slides when we send them out, but specific information, an employee will date the notice, put in the information regarding why they can't work or why they need to receive the paid sick leave or the FMLA. They will put a few other pieces of information and the employee will sign it. So it will be a legal document. Obviously, it can be audited at any time, but they're expanding this definition of documentation to include employee affidavits now. This is incredibly important for those that can't get out of their house or can't get to the doctor, can't get a doctor to sign something because they're overwhelmed, understandably. So they're expanding that definition as well. And again, this is updating every day. There might be a new interpretation out tomorrow. We'll send all of those updates out through the chamber as they come in. One of the important things that I think has missed a lot of small businesses and employers over the last few weeks is that the emergency sick leave does not apply for work sites that closed before April 1st or for work sites that close on or after April 1st, except if an employee is already on paid sick leave. So if an employee, if you're open before April 1st, an employee had to go out on paid sick leave because of symptoms or whatever the case may be, and then you decide to close your work site, the employee can still get the paid sick leave up to the cap, the 2-week cap or 10-day cap or 80 hours for full-time employees. But if an employee gets sick after you've closed your work site, whether it's before or after April 1st, they cannot get the paid sick leave. Any time that they are not working due to a work site closure is going to fall under the unemployment program. So that's a question that I've received a lot on my side. I don't know if there's any other unique situations, but generally, if the employee was already sick and out on sick leave before or after, and then you close your work site, they can continue getting that paid sick leave. But if you close your work site first and then they get sick, they're not going to be able to get the paid sick leave. That'll fall under unemployment, or their time off will fall under unemployment. Another question that we're getting a lot of is the FMLA cap. So for small businesses who are not used to the standard FMLA program, it is a 12-week program.
I was going to sit on that chair for.
So it's a 12-week program, rolling calendar year, or I'm sorry, rolling year, 12 months, or a 12-month period, rolling calendar year. So if you go by January 1st to December 31st, if you go based off of your business, your fiscal year, or if you go based off of a rolling period where if an employee gets sick last year and they needed to take FMLA, they don't get another 12 weeks until that same date the following year. The FMLA is capped at 12 weeks. There's been a lot of questions in regards to how COVID-19 FMLA relates to any other FMLA that they may have already taken. So for those employers who are over 50 and 50 employees, and an employee has already taken some of their FMLA time during whatever period they use for FMLA calculations, that employee cannot get anything beyond their 12-week maximum for this current COVID-19 situation. It's a little bit complicated. If you're not currently implementing FMLA because you don't meet that 50 employee requirement, your employees are going to get the full 12 weeks. 2 weeks of that is that paid leave under the Emergency Paid Leave Act, and then the rest of that is the paid leave under the FMLA paid portion expansion, but it's still only 12 weeks total. If there's any questions along those lines, definitely send them in. It can get a little bit complicated, but again, if you're a small business and you're under 50 employees, you're not going to be seeing any kind of other FMLA taken under the current standard program. Important exemption is that healthcare workers are exempt from these regulations. I think that's unfortunate because they're probably the ones that need it most due to their high risk of exposure, but they are exempt from these regulations, so they do not get any of these coverages. There are also some exemptions based on child care leave. If an employer is a small business and the child care leave would put a large financial burden on that employer, or if the employee who's requesting the child care leave has really high specialized skills that the employer can't let go of during this period of time, they need to stay in business and they need that person at work. There are some exemptions where an employer can basically decline the child care leave portion. So that would be if an employee needs to take care of their child. There's also an exemption under lack of sufficient workers available. So depending on your employer size and what's in the market, what's available, who you can pull in to help if needed, if you don't have those options and you need that employee to work, there are some options to decline their child care leave. That doesn't mean the employee won't walk off the job. That might happen, but as an employer, you have work that you want to try to keep doing during this period of time. Another update that happened just this morning is giving notice to an employer. The employee can't just not show up for work. They do need to give notice to their employer that they need to take sick leave time or sick time to care for a family member who needs some assistance or to care for children. I think probably at this point, most of us know who's out for childcare because the schools have been closed for a little while. But as far as anything going forward for sick leave, or if something changes with the childcare situation and an employee needs to take time off, they do need to make that request. A formal request can be an email, a voicemail, a text message. It's pretty lenient these days on how we can get that notification. And then we did talk a little bit about those affidavits from employees. If an employee can't get an email from the school, if they can't get an email from a doctor or an email from a daycare provider, or if they're just showing the symptoms, we can set up just a simple signed affidavit that the employee fills out why they need to take the time off, what the reason is for the time off, and that way you'll have it as an employer for the tax credit portions.
Laura?
Yep.
Can you tell me, are chiropractors, dentists, are those all under the health care workers? So they fall under that category?
So that is still, I haven't seen any details on healthcare workers, but generally anything that is providing care for those that need ongoing medical care, or like our hospitals, our clinics. If it's an emergency dental situation, I've seen our dentist has sent out information regarding what their hours are and what their options are for emergency situations. It really just depends on what their role is within the company. I recommend that if anybody has any questions, to send them over. We'll go through it specifically based on that person, that employer, the circumstances, whatever the case may be. It's like a moving target these days. Today, we might define it this way. Tomorrow, it'll be defined a different way. It's hard to keep up with all of these changes, but we'll make the best decision with the information we have presently. And then if anything changes going forward, we can make those adjustments. That's my general philosophy anyway in the HR realm, but certainly in regards to this situation. Were there any other questions, Trish? No. So as far as the tax credits for paid sick leave and paid FMLA leave, I've included some of the highlights of the basic information. As you can see down at the bottom, I have put a big star. Contact your accountant for more information. I've provided some of the IRS and other state filing links in order to see the information, but I highly recommend, I think there were a few accounting firms that were on this presentation or on the list of attendees today. Definitely contact your accountant to make sure that you have the most current information and that you're applying it correctly. I'm not an accountant, but the general overview for this paid sick leave and paid FMLA leave is that employers are going to file for these tax credits during their regular calendar quarter tax filings. The amount of wages, so what's being paid out of the emergency sick leave and paid out of the expanded FMLA leave portion, is equal to 100% of wages. So dollar for dollar, employers are getting a tax break for those qualified sick leave and qualified family leave wages. As we mentioned earlier, the additional amounts that are being provided in a tax credit are some of the costs that are associated with managing the group health plan during those paid leaves. We also have in here the federal income tax withheld, employee share of the Social Security, Medicare taxes, employer share of Social Security and Medicare taxes. There's a whole bunch of information that's being sent out now regarding tax credit. Obviously, we just hit the first quarter, and so people are focused on preparing for next quarter for their taxes. Make sure that you have all of your documentation together. Like I said, documentation in the form of the reasons why people are taking the time off, and then what you've paid as far as paid timesheets, payroll, however you're classifying it. What I've done for a lot of the small businesses that I work with is I have set up a paid leave category specifically for the emergency paid leave and for the expanded FMLA program, so that we're tracking by employee when they're taking time off. You can do this through any of your HRIS systems or payroll systems that you use, timesheets, T-sheets through QuickBooks. You can also just do a simple spreadsheet on Excel and keep track of it. However you can keep track of it, keep track of it. The more documentation you have, the easier it'll be at the filing point. And then as far as the process is concerned, the information that I'm seeing through all of the different sources is that you're basically retaining your payments off of your taxes. So you're sending in the information, but instead of paying your taxes and getting reimbursed for this, you're just retaining your tax payments that might be applicable during this period. So you're not having to exchange money back and forth with the government. That if there's a tax refund, I'm seeing that the government is processing these in up to 2 weeks from filing. So it seems like a pretty quick process. We'll see how it is when everybody else in the country is also filing at the same time. But right now they're estimating up to 2 weeks for processing. I'm not going to stop for questions on tax credits because that's the extent of my knowledge on taxes. But as I said, definitely contact your accountants, talk through the process, make sure you're keeping track of everything, documenting everything, and then talking with your accountant when you get to the point of filing. So we have had some good questions in regards to unemployment benefits. I think it's really important to recognize that unemployment benefits are being relaxed or expanded to help with this situation. The processing time has been shortened. There's no longer a waiting period for payments. So in some states, you have to wait at least a week before you can receive payments. You don't get that first week of payments, but now they're relaxing that. So under the federal side, the eligibility expansion is now including any businesses that have to temporarily close due to COVID-19, any employees that are quarantined, and generally are expected to return to work after the quarantine is over. And any employee who leaves employment due to a risk of exposure or an actual infection, or to care for a family member that has had that. So we're seeing that expansion under the federal side. Some of the exceptions are going to be if you're receiving the paid sick leave or the paid family leave, you cannot also you can't double dip, so to speak. You can get the paid sick leave during the first 2 weeks of a FMLA leave. You can get the paid leave for the rest of the portion that you need to be out. If you're still out and the company has closed, then you can apply for unemployment at that point. Or if the company, under regular requirements, if under unemployment, if the company needs to lay off its workforce at a certain point in the future, or reduce hours, or whatever the case may be. Under Missouri, the eligibility has been expanded to include that layoff. As I mentioned, layoff, loss of production due to this whole situation, any mandatory quarantines that are due to a suspicion of having the COVID-19 virus. There are some in here that are listed as possibly, so I want to bring close attention to that. There are a number of factors that impact unemployment in general, but it's expanded even more with the COVID-19. So asymptomatic, but you're self-quarantined, there needs to be some legitimate reason for you to be self-quarantining yourself or a high risk of exposure. Some of the portions under being sick due to COVID are going to apply. I recommend that if any employee has any interest in filing for unemployment, no matter what, whether it's a regular unemployment situation or this specific COVID-19 situation, to apply. Let the state process and work through their requirements for whether or not you qualify.
Laura, is that included in the 1099 contract or the sole proprietors for the unemployment?
So it's a great question. It really depends on how the employer is classified. So as far as self-employees or self-employment sole proprietors, right now there are no stipulations out there to provide unemployment for them. The exception might be is if they're classified as an S Corp. And if I always, so as far as this situation is concerned, if the employer, the company, the sole proprietor, the S Corp, however they're defined, if they are paying into the unemployment program quarterly, generally speaking, if they have a qualifying reason, they will be able to draw down from that. But if you're not paying anything into the unemployment program currently, there's nothing for you to draw down on. And right now, there's no government requirements to pay for those situations. Not yet. I've seen some indication of that over the last few weeks, but nothing was included in this recent bill that was provided. They only specified employers who are paying into the unemployment program on a regular basis. Any other questions, Trish?
Are you familiar with any of the loans that are out there that would help those, with unemployment for 1099s and?
Sure. So there are a lot of, under the Small Business Administration, and I don't know if I included it in this presentation, but there's definitely some loans and grants. Grants are better than loans for small businesses that need some assistance, whether it's due to loss of production, loss of clientele. So it's more along the lines of your company is not able to earn as opposed to an unemployment benefit. So I don't know specifically any of the details of that, but I will pass over the links to the Small Business Administration, and employers can go through that. The self-employed can go through that information. Again, I'm sure there are a lot of lawyers out there, and if any of them are on this presentation, definitely let us know if you're willing to pass along information. It's very complex and complicated, and as I mentioned, it changes daily. So what we're talking about today could be completely different tomorrow.
I do have a follow-up to that last question, and then another one. Do those who are true 1099s and file their own taxes, should they be eligible for unemployment benefit because they've been paid? Because they're paid? So it says,
repeat that question.
Those who are true 1099 and they file their own taxes, should they be eligible for unemployment benefits?
So that if they're paying into the unemployment program when they're paying their taxes, then they should be able to file. And then it's based on the qualifications through Missouri. But if they're not paying into the unemployment program, they can't draw, not at this point, they can't draw out of it.
Okay.
So you think of unemployment as a batch of money that every employer is paying into. You pay it quarterly. You put a bunch of money in. If somebody ends up filing for unemployment due to reduction in workforce or whatever the case may be in a normal employment situation, when they are awarded benefits, those benefits are essentially drawn down from your bank in the state program. That's why your rates will go up, because you're drawing out of it. So they want you to put more into it to cover for future situations. But if you're not paying anything into it, they're not allowing you to take anything out of it at this point.
Okay, well, I have an employee who's under the impression that they can get regular unemployment rate plus $600 per week. Any idea where that came from and if it's true?
So there is an expansion under the unemployment benefits. I have heard about this, the additional $600. I don't know if it's related to the unemployment side or if it's falling under another program. We'll include that in our list of questions, and I'll send out the information on that. But yes, I've heard the same thing. Nothing in writing yet, but I've heard the same thing.
That's all for now.
Okay. Under Missouri exceptions, if you're not able to work due to a school or a daycare closure, you're not going to be able to file for unemployment benefits. If your employee has already exhausted their unemployment benefits for the benefit year, then they are also not allowed to dip into the unemployment benefits again. So those are probably, as far as the exhaustion of unemployment benefits, those are probably highly unlikely, because if the employee has been employed with you for a few years, they wouldn't have been using unemployment during breaks in between employers. But I think the important one to see is that if you can't work and it's beyond that 12 weeks of paid FMLA or 10 weeks of paid and then 2 weeks of emergency paid leave, that employee is not going to be able to file for unemployment after that time period if they still cannot work due to closures. I'm hoping in 3 months we are not in the same state we are now, but just a heads up. So switching over to other employment related topics, a lot of companies are asking questions about OSHA and workplace safety. There's nothing in place that specifically addresses the COVID-19 situations, but generally speaking, we are just moving forward as we normally would with making sure that we have personal protective equipment, including respiratory protection, if we're required to under a normal OSHA requirement. The general duty clause for all employers is to furnish a safe workplace. So however we need to define that based on our individual workplaces, we need to continue to provide that. There are state-approved OSHA plans that are out there for certain states, but in Missouri, there's no state-approved OSHA plan, so we fall under the federal regulations. There is some new guidance for employers, and you'll receive a link to this through the presentation materials that we send out, but there is a new guidance out there regarding how employers can prepare their workplaces in regards to COVID-19. Hopefully you guys have seen some of that already. At this point, I think we're a month into the spread of the virus. So this was posted in March, so not too recently, but within the last few weeks. But there's just some guidelines and information for employers on how they can go about making sure that their workplaces are as clean and as prepared as possible for preventing the spread of the virus. But again, in general, in regards to the workplace, you're going to fall under the same OSHA guidelines as we normally do for just generally providing a safe workplace for all employees. As far as workers' compensation is concerned, I'm not going to cover this too much in detail because a lot of this has to do with individual specific information regarding each claim. As a general, just like on the unemployment side, as a general guidance for all employers, I recommend that if employees claim something happened in the workplace, report it to your insurance provider and let them do the investigation. They're the ones who are the most qualified to provide information and investigation and assistance on whether or not something qualifies under your workers' comp program. But generally, exposures that can be linked to the workplace, if it's linked to travel for work reasons, if they're working in a high-risk environment, like our hospital healthcare workers, they're generally going to be covered under the employer's workers' comp program. But again, it really just depends on a lot of specific information. I've had some claims over the past non-related to virus situations where employees, got hurt on the job. They claim they got hurt on the job, that they twisted their knee and had to have surgery. Come to find out that during a workers' comp investigation, they found that that person had posted pictures on Facebook of them performing roofing work and even made a comment that they had fallen off their ladder. So just like with any normal workers' comp situation, let your workers' comp carrier perform the investigation so that they can properly document and really make sure that they're falling in line with the exposure requirements under the workers' comp program in the state. Every state is different, so if you have employees that work in different states, make sure that they're going through that process through your carrier. Again, if there's any claim that is determined compensable, handle it according to your normal workers' comp program. Nothing really changes in this respect, but I always like to make sure that employers know those that are allowed or required to provide for FMLA under normal circumstances with 50 or more employees, and now certainly those smaller employers that have to provide the leave under the new expansion of FMLA and under the paid sick leave, those are going to run concurrently with any workers' comp situation. So make sure that if somebody does need to take time off work because they've had an exposure at work and it is deemed workers' comp compensable, make sure that you are also running that FMLA time concurrently at the same time. They don't get workers' comp as far as time off is concerned and then get another 12 weeks after that. You're running them at the same time. If anybody has any questions on that, let me know. I have plenty of templates and forms and things that help to keep it easy on the management side. Another thing, and I think this is my last slide, another thing to cover is discrimination. We've all, for those employers that are 10 or more, we're all familiar with the Americans with Disabilities Act and the limitations that we have on asking employees certain types of information in regards to medical situations. We want to make sure that we are keeping kind of a consistent approach with how we handle situations that are related to the COVID-19 virus. There are some expansions of allowances to ask employees regarding symptoms and or testing and things like that, or taking even a temperature before they walk into the work environment. But it doesn't mean that we can just do whatever we want with those employees. So we want to make sure that we are taking a consistent approach and that we're applying that approach evenly to every employee in our workplace. So as of March 24th, as I mentioned, you're allowed to ask the employee if they're experiencing any symptoms. You're allowed to take body temperatures, keeping in mind that a fever does not always indicate that COVID-19 is in play. It can definitely be a virus that does not include a fever. I heard an example the other day of a person who had a runny nose and went in and tested positive, and unfortunately that person did not make it. So it is something that is ever changing, and we don't have all the information, but we need to have that consistent approach in how we treat employees in the workplace. If employees are having the symptoms and are instructed to leave, make sure you're applying the same rule of thumb to all of the employees that you ask to leave the workplace due to concerns of exposure or the symptoms. You do want to require an employee to provide a return to work note, although those types of documentation or types of return to work notes are changing. We're allowing emails, we're allowing voicemails, a doctor's voicemail. You can have an affidavit from the employee saying that they started symptoms on this date and it's been 7 days and they're fever-free for 72 hours, or they don't have any symptoms for the last 7 days, whatever the case may be. And then as far as hiring is concerned, for those of you who are actually doing hiring during this time, which I'm hopeful that some of you are, if you're hiring, you're allowed to screen employees just specifically for the COVID-19 virus, only after a conditional offer has been made, and as long as it's been consistently applied. You can hire an employee, and if the candidate is positive for COVID-19, you can defer that start date until the person has been cleared or until they've met your return to work guidelines. If you're hiring and somebody is tested positive, but you need that person to start immediately, you can then withdraw the offer due to this situation. Again, you want to make sure that you're applying this consistently across the board. There are going to be different jobs that have different requirements, that have different exposure situations, or you may need to make a different decision on based on the specifics of the job. That's okay, document it, and as long as you're consistent within your thought process and handling hires going forward while this COVID-19 is still in place, then do that. And always let us know if you have any questions. You're welcome to contact me and we can talk through it. It's a little bit unusual, different situation. So that's the end of my slides. And as I mentioned before, if you have any questions, send them to Trish. We'll compile them all. I'll answer those. We'll be sending out a copy of the slides and a copy of the video for reviewing. But Trish, I think we have a few minutes if there's any questions from anybody on the line still.
I don't see any questions coming in.
Okay.
So.
Well, I'm happy to stick around for a few minutes if anything does, or.
Yeah, up to you. This would conclude our session. I just want to remind everybody that the next virtual power hour for the chamber is next Thursday at 11 o'clock, same time. You'll get an email with the password after you register. So it is on leading during change and uncertainty. Deb Coons is going to be presenting for us. So one that you can learn from. So thank you, Laura. You are a wealth of knowledge. Everyone, if you need Laura's information, let me know. We'll get it out to you. But thank you very much.